afternoon, members. You're very welcome to the January meeting of our Health and Social Care Services Subcommittee. I'm going to move to item 2 in the agenda, which is for us to receive the nomination for the position of chair for the subcommittee, and it's a DUP nomination, so I'll proceed to invite Councillor Thompson to nominate.
Thank you, Alison, and thanks, Stephen. On behalf of the Democratic Unionist Party, I propose Councillor Paul Stevenson to be the chair of the Fermanagh Health and Social Care Services Subcommittee for the time ahead.
I would like to second that, Councillor Fitzgerald.
Thank you very much, Councillor Thompson, Councillor Fitzgerald, and I'll just hand over now to Councillor Stevenson to take us through the rest of the meeting.
Thank you, Chief Executive, and thank you for giving me this job of chairing this meeting. We will carry on and we will take apologies.
Chair, we've received an apology from Councillor Stephen McCann, please.
Anyone else?
Sorry, Chair. Adam Davidson from IT reported that Bert Wilson is unable to attend, so he just let me know just prior to the meeting.
Thank you. If that's all, we'll carry on to number 3, which is the proposing and seconding to adopt the minutes of the previous meeting held on the 14th of October 2021.
Chair, we have our minutes adopted, so we can proceed now to matters arising. Thank you. Sorry, to declarations first of all, and then matters arising.
Okay, next is declarations of interest.
Okay. No indications, Chair. Oh, sorry, Councillor Deehan.
Councillor Deehan.
Yes, thank you, Chair, and congratulations, Councillor Stevenson, on your appointment as chair of this important committee. Certainly at a time when our health services are in crisis, it really is a very important role, and I want to wish you every success in it. Declaration of interest, just as a member of the local commissioning group of the board of the Southwest GP Federation, and also as a member of the Western Area Outcomes Group. Thank you, Chair.
Thank you. Councillor Warrington.
Thank you, Chair. I am a member of the local commissioning group. Thank you.
Thank you. Anyone else? If not, we'll move on to matters arising, and we will go through the minutes page by page. Page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, page 9, page 10, page 11, page 12. See, nothing coming up with that one there. So we will move on to item number 6, to receive response from the Western Health and Social Care Trust on matters brought up by the members.
Okay. Thank you very much for giving me the opportunity to respond to the questions that you've asked and the issues you've raised. I think before we start, it's important to point out that we are still in our business continuity arrangements, and therefore there's a number of directors not available today. So I will do my best as the lone person with Chris' support here to take you through the update and the answers to your issues. as best I can. So, and if I can't, I will get a written report from the relevant director and come back to you. So if you want me to just proceed now, Chair, I'll start with number 1.
Yes, walk away.
Okay, so this is a question around the acute mental health services, including capital investment in OMA. So as you all know, Karen O'Brien is our Director of Mental Health Services, and she's not with me today. I understand a paper is being prepared for MLA briefing and will be circulated on the 4th of February, and Chris will share once it is complete with all interested groups and parties. Any specific questions around this today, I will take back to Karen and we will provide you with a written response. So I'm not briefed on any current update around mental health services at this minute in time. Sorry, I only got the agenda this morning.
Councillor Dehan, you have raised your hand.
Well, thank you, Chair, and thank you, Geraldine. And I appreciate that you may not be fully briefed on this issue. And I await with anticipation the paper which is due to be published on the 4th of February. I suppose many members have raised in this forum and elsewhere our concerns regarding progression of the acute mental health unit for OMA. And this has been long promised, but sadly has not yet been delivered. And we feel that this project should be progressed as a matter of urgency. Our present facilities, whilst they have been upgraded, I think fall far short of what we have come to expect for acute mental health services. I think we have passed the era where mental health services had traditionally been regarded as a Cinderella service. And I really hope that that paper on the 4th of February will give us some time frame when we can expect the delivery of that project. So thank you, Chair.
Thank you. Councillor McElduff. Councillor McElduff seems to have lost connection or something.
Yeah, it's showing low bandwidth at Barry's side there, just.
Okay.
Back there again now.
I thank you. Sorry about that. I'm in the Strull Arts Centre. I'm making use of a facility here because I had a previous meeting, and hope the internet holds up here. I asked that this item be placed on the agenda, and I'm very, very conscious that the facilities in OMA are very, very poor. For example, if you're transferred to Elm or Lyme, it could be something from another century. It's like an old school building, and it just doesn't fit the needs of the people, and it doesn't contribute to people's mental health recovery at all in the way that it should, in my opinion. I'm not a clinical expert, but we do need sooner rather than later these facilities to be developed in the new hospital, as has been promised. And 400,000 I think was spent on facelifts or whatever, but that's why I think, and I do understand the difference between the trust and the department and the Health and Social Care Board. This is not the trust sleeping in it at all. This isn't a case of that at all. In fact, the trust has been a supporter of this. But I think as our nearest port of call, our nearest point of contact with the health service, we would like the trust to get us information as soon as possible about when this is going to be remedied. Thank you, Chair.
Thank you. Councillor Earl Thompson.
Thank you very much, Chair. Congratulations on your new role. No doubt about it, you'll do well on it. Just like my OMA Town colleagues, Councillor Dehan and Councillor McAduff, I have great concerns with regard to this as well. As somebody who was born and raised in OMA, we had the best of mental health services in OMA Town for years and years, and we were promised this when we had the new hospital, Omagh Hospital and Primary Care Complex was built and opened. This was to come to it as well. So I know Geraldine's on the call here, but I know it's not your, that you can't directly answer this, Geraldine, but I think Councillor McAduff's right, and that you're our first port of call, if you like. And we need to know where this is going to be, and hopefully we've all campaigned for this. Or I think all parties campaigned for it, and it was on our election paperwork. So we want to see this delivered sooner rather than later, and we look forward, as Councillor Dehan said, to the paper coming on the 4th of February, I believe it is. So I'll leave it at that now, Chair. Thanks again.
Thank you, Councillor Thompson. Councillor Anne-Marie Fitzgerald.
Yes, thanks, Paul, and congratulations on your role and every success. Just on that, Geraldine, thanks a lot for your briefing, and same thing, the front line always gets hit the worst. And yeah, just on that, it'll be very, very interesting to see. And you know what, I'm not going to go over things here, but there is a huge range of things within the mental health services in Omagh, which is causing quite concern for a while. And whether that be the crisis mental health team, patients turning up in urgent care, or patients being at home, mental health, they're looking to go into a safe place, and that safe place is to be down in a Skillen. And why they can't be sort of helped or sort of held in Omagh urgent care in a safe, much quieter place, and have the crisis mental health team attend there. But I'm aware there's only one mental health team nurse on at night, who doesn't want to go up and down the road, and it's much easier down there. But do you know what? It's getting more chaotic as the time goes on, because we're filling already department down the Southwest Acute Hospital, and whereas overloaded, there's nowhere to put them. There's no quiet space, whereas Omagh is better utilised. And just on the chair beds going on forward, you know, like these chair beds is another big issue which is going on, and where patients can be in a chair bed for numerous days without a bed. And just as everybody else said, the dormitory style wards in Elm and Lime with mental health patients, or patients with, you know, with depression and things, constant moving about and speaking and talking and noise. So it's not good. But you know what, we're not saying nothing that we don't know, but it's just hopefully we'll have good progression and with the new unit going on ahead. Thank you.
Thank you. Geraldine, over to you.
Yeah, so okay, I see Chris writing away frantically there, so he's made a list, and so have I, of all the issues you raised today. And we will have a briefing, Chris, I'm right, aren't I, around the 4th of February, briefing for MLAs and our elected councillors, etc. I don't know if it'll be a full briefing, but maybe you could just confirm that's the case.
We have a face-to-face briefing in the same manner as this on the 4th of February with MLAs and MPs. We'll provide them the written briefing directly after that to all elected representatives here. It could be something maybe that if required next time around, when the next council meeting is on, that we could maybe look at getting the team, the mental health team that are actually involved in that, with Karen Leighton, Geraldine, that they could come along as part of that and actually deliver that briefing as well at this and take questions on it.
I think it's really important that that happens next time round, Chris, because I absolutely accept this issue has been raised a few times with members here, councillors here. So I think it's important we bring our Director of Mental Health Services back to the meeting. Yeah.
I have two councillors looking to come in there. Is Anne-Marie, are you looking to come in again?
No, sorry, I took down my hand. Apologies, Chair.
Okay, Councillor Earl, are you looking to?
Thanks again, Chair, and thanks, folks, for your answers. Just, I think we need to formally propose that actually happens, that we get the team here to deliver what they need to deliver to us, either in a presentation form or whatever it takes. So I think I'll formally propose that happens for our next meeting.
Thank you. Councillor Dehan, you seconding that proposal?
Yes, thank you. I'll second, Chair. Thank you.
Yes, thank you. Is all in agree? Seems to be all agreeable.
Yes.
Continue on now, Geraldine, please.
Okay, so your second point is around waiting lists and delays for cancer patients and orthopedic patients in relation to assessment and surgery. So I'm just going to take you through a number of points that I feel is important that you understand why we find ourselves in the position we're in. So the first thing is that pressures remain across our acute hospital sites, both from an unscheduled care perspective and COVID pressures. South West Acute in particularly has had unprecedented number of patients waiting for admission to ward beds from ED since pre-Christmas right through to today. The hospital has been escalated across all areas to manage this on a daily basis, and we continue to manage patients in this manner because of the high number of attendances and obviously the high pressures across the site. So in terms of COVID, patient numbers continue to reduce daily, both in our COVID wards and in our intensive care unit. However, staff members who have tested positive or are isolating for any reason has added to the pressures that we have faced now since before Christmas. Although again, reducing numbers of staff off, but we're not everyone is completely back yet. Today we have 13 patients who are COVID positive on site. I suppose the reason I give you that context, this is all added to and impacted on our ability to deliver elective care. Elective care has not returned to pre-COVID levels as we continue to manage these pressures, but we do prioritise and manage red flag and time critical services. So in terms of outpatients, we prioritise our red flag patients and any patients from other services that are time critical. In terms of our cancer day case inpatient operating, we again prioritise all specialties who require and have patients that must be treated within a number of days or weeks. This week we had 102 elective sessions running across the trust. That's Galvin, Omagh and South West Acute, and that is compared to pre-Christmas levels of between 50 to 80 sessions. So we are improving and we are on a weekly basis enhancing the number of operating sessions that we can run. We continue to review weekly any potential opportunity for increase in activity. Our waiting times, although, continue to grow across all specialties, and you'll be very aware of these from the most recent waiting time Department of Health statistics. We are currently tracking almost 3,900 patients across our cancer pathways, and that is our 14-day, our 31 and 62-day pathways. So currently, as of today, our 14-day breast patients, all breast patients are booked within the 14-day window. Our 31-day patients, and that's patients who have a first definitive treatment, we are running about 98 to 100% of those patients having their first treatment. And then our 62-day, where the patient should have completed their journey or at least have had their first operative procedure, etc., we're running around 48% to 50%. So you can see the impact of the reduction in our theatre sessions is definitely impacting on our 62-day cancer performance. In terms of orthopedics, our weekly sessions running now for elective orthopedics is up to 4 to 6 sessions per week, depending on the amount of trauma we have. And I suppose the trauma does impact on our elective capacity, because over the last few weeks we have seen an increase in trauma, that is fractures, particularly patients falling or trauma injuries. And where we might have an elective session set aside for an operative elective list, sometimes we have to convert that to trauma to ensure patients who need it treated immediately get their treatment. There's also a number of sessions running additionally at weekends, and you'll have seen some of that across our social media platforms. And yesterday you will have seen the minister's statement around an IS provider who has come in and leased a vacant capacity in South West Acute Hospital theatre and a ward to deliver orthopedic hip surgery to the end of March. The initial lease is for 100 operations, and last week we had 21 patients who had their operation there last week. And I suppose this is a collaboration between the trust and the IS provider to ensure that we use all capacity available to us, and I would hope you would support us in that. And I suppose the ask now is that how many more could we do there with the capacity we have. So I suppose it's an ever-changing situation. It doesn't mean that we will deal with the high volume of patients waiting excessive times quickly, but at least we will start to make some inroads into that. At this minute in time, our longest waiter for an orthopedic procedure is 322 weeks.
Thank you. Councillor Warrington.
Thank you, Chair, and I forgot to wish you all the best in your tenure as Chair. I've been in that chair for a couple of occasions, so this is a great committee. I'm glad that Geraldine, you've already hit on obviously the orthopedics that are taking place in the SWA. That's really what I've my hand up for. It's good to see that the facilities are being utilised. We all know the stresses around COVID, obviously still, and problems with moving on. You were saying that they're just up until the end of March, which in fairness is not too far away. Is there any possibility of them being extended after that as we move forward? Because obviously if they're planning on doing 100 well, I take it is it hips or is it a mixture of orthopedic procedures? You know, obviously that is part of our biggest problem in waiting is procedures like knee replacements and hip replacements. And certainly if these people can move those numbers on quickly, that is bound to be a help to the waiting lists as we have them at this time.
So thank you, Councillor Warrington. And I suppose the initial lease, as I said, or the initial contract is for the first 100, and they are all hips as per the request and the longest waiting patients. However, I think it's fair to say that the success after 1 week, even in terms of the experience for the patient and the outcome for the patient, all patients were treated. About 40% of them went home in 1 day. Last week went home on the day of surgery, and all patients, 100% of them that didn't go home on the day of surgery went home on day 1 post-op, which is immense recovery for a hip operation, as you would all know. So the plan, we're in negotiation now with the provider and the Health and Social Care Board around how much more can we do. Currently, they're only working Monday to Friday. Could we extend it out to a 7-day working week? And could we do many more? So those discussions are ongoing, Councillor Warrington, and I can bring you back the detail. I suppose it's about testing at this minute in time, but the outcome and the initial feedback seems to be very good at this time.
Thank you. Well, obviously, if it proves to be successful, it'll be something that both yourselves and the DOH will have to look at positively moving forward, because there's no doubt that it will have an effect on our waiting lists. Thank you.
Councillor Barry McElduff.
Okay, thank you, Chair. And again, best wishes in your new role, Chair. My point would be that as public representatives who don't have, in most cases anyway, clinical expertise, you know, we don't, but we still find ourselves being contacted by people. And I was contacted recently by a local man, and he did appear to be a red flag and a time critical patient who was having difficulty getting an appointment. So I'm just wondering how those things happen, and what is the role, say, for example, of primary care, the GP or GP's colleagues, in helping to communicate with the trust in these matters, you know, because can you imagine, the role of a public representative includes making representations for people who are red flag, time critical patients to ensure that they are being heard? That's my question, Chair. Thank you.
So, Councillor McIndoff, when a patient attends their GP and the referral is made to the trust for an assessment, either at outpatients or whatever service area that they will refer that patient on to, the GP will red flag the patient at that point based on the information they have. When the referral is picked up, and we have a system in place every day that picks up all red flag referrals, the consultant, there's criteria, they can review them, but in the main, the patient is added to a red flag list and treated through the specialty as quickly as possible. So if you have a patient that you believe is a red flag or a time critical patient that is waiting a long time, I would like to know about it, Councillor McIndoff, and I will pick it up if you could send me the patient details.
Yeah.
The referral pathway for red flag is very slick, but I'm not saying we're all human at the end of the day, but I would like to know about it, absolutely.
Yep, thank you very much. And again, to thank Chris for his role as the point of contact for us, that's very helpful as well, Geraldine. Thank you.
Yeah, absolutely.
Councillor Josephine Deacon.
Thank you, Chair, and thank you, Geraldine, for your update. And I think, broadly speaking, this is very good news, and I welcome it. And please do pass our appreciation to all our colleagues, both in the NHS and in the independent sector, for their very significant contribution to the delivery of patient care. First of all, in relation to the cancer patients, I think the figures you present here today are very good. I suppose I would have to raise concern regarding your 62-day targets, and under 50% or under, I suppose that there is room for significant improvement in that area. As we all know, a cancer diagnosis carries with it a very high degree of anxiety and concern for the patient and their families. And, it's so imperative that our cancer patients are given the highest priority. The orthopedic patients as well, because they suffer great pain and disability. And I welcome the initiatives that the Trust has introduced to address these totally unacceptably long waiting times for orthopedic patients. I think the longest waiting times of 322 weeks is really quite shocking and unbelievable in this day and age. But I appreciate the difficulties that you have. I just wanted to ask. Sorry, my phone's ringing here. I just wanted to ask about other orthopedic waiting list initiatives, and I am aware of an initiative, and I just wondered if it's still going on, whereby orthopedic patients can access orthopedic care elsewhere. They can source it themselves and access the treatment, whether it's a joint replacement or whatever, and then the patient will pay up front and be either partially or reimbursed subsequently by the Trust for their treatment. And I just wanted to inquire if that initiative is still in place. Thank you, Chair, and apologies for the interruption from my phone. Thank you.
Yeah, Councillor Deacon, thank you for your questions. I think I share your anxiety around the 62-day performance, and we work really hard to try and enhance our elective performance as quickly as we can. Hence the increase in elective sessions and the prioritisation of red flag cancer patients for their surgery. So that is an ongoing piece that we will continue to do over the next number of weeks and months until we get back on a stable footing with that. I should have said in terms of the initiative, the IS provider, this is not the only initiative that's happening across the region. I think it would be fair to say that to try and tackle orthopedic weights in particular, there's quite a number of IS providers who are involved in this. Some patients have gone to Galway, some have gone to other independent sector providers across the region. But for us, this particular provider approached us to use our vacant capacity. So absolutely, I think anything we can do to try and reduce the waits for patients who have a really poor quality of life in terms of pain and mobility, etc., we should do. The EU directive pre-Brexit was in place, and then at the time of Brexit, it stopped, but it is now up and running again, Councillor Deehan, and patients can avail of that opportunity if they wish. And all the information is held within the trust and within the Health and Social Care Board of how they can access. They could Google it because it's all out there anyway of how they can do it, and they're absolutely entitled to do that. And then just finally, although the first 100 patients of our collaborative initiative were hip patients, if we were going forward with any further discussions, we would be asking for a different type of skill mix in terms. There's definitely patients who require ankle surgery, knee surgery, and other joint replacements that we need to be also helping with. So we would hope to try and bring that to the table if we're going forward with this after March.
Okay. Thank you, Chair.
Councillor Diane Armstrong.
Thank you, Chair, and congratulations to you in your new role. I'm sure you'll cope very well, and it's good to have you on board. My question is echoing some of what Councillor Deehan has said, to really show appreciation for the information we're being given, because naturally constituents do ask, and it's good to be in a position to relay in a sensible manner, you know, that there are improvements, that we're not setting expectations too high, but to see that progress is being made. So again, I'd echo my thanks for the work you are doing. Geraldine, the question I wanted to ask was about the orthopedics. 100 hip operations, and it's tremendous to see that. And I'm just wondering, are there resources there to support the discharge, the patient aftercare, the recovery, rehabilitation? Is that something that is in place? And if further attempts are being made at broadening the service and increasing operations, are we assured of that being in place to assist patients aftercare?
So thank you, Councillor Armstrong. I suppose we have spent a number of months going through the lease and the specification, and particularly for me and trust directors, the pathway for patients. So I would like to reassure you completely that the full journey for the patient is included in this, including their physio and their aftercare plus follow-up. Resources are available. The IS provider had to provide the trust with all their assurances around that, and I went on Friday to the Southwest Acute just to reassure you all, to see for myself how it was running after 5 days, and I can absolutely confirm that all the resources are in place, the staffing, the medical input, the theatre activity. We also have asked one of our lead nurses to be the governance lead from a trust perspective in this. So we will monitor on a weekly, monthly basis how patient outcomes are, how, you know, the outcomes for patients as they are followed up and go forward. So I suppose at this initial stage, I can give you the assurance that we have covered all angles of the pathway with the independent sector provider.
Excellent. Thank you, Geraldine. And these are for patients in the Western Trust area only?
No, these are regional. So the first 100 patients that went to this provider for assessment and treatment, and 50 patients came from the Western Trust and 50 patients came from the Belfast Trust.
Okay.
So this is a regional service for patients.
Thank you very much, Geraldine. That's really helpful. Thank you.
Councillor Anne-Marie Fitzgerald.
Yes, thanks again, Geraldine. I'll be very brief. I think that's all very welcome. A long list and red flags. I know that a lot of people have great experience, even this last few months from the service, and sadly, but there's nobody slipping through the hoops. But I know that there is people out there who are really, really appreciative of the treatment and the service and the quickness of that it is, and can't believe of the negative publicity behind scenes, which sadly there does be. Just on that, Geraldine, do you see anybody going for surgery? They either have to go to SWA or down to Altnagalvin for a COVID test a few days beforehand. Now, there seems to be, I'm just wondering, I know that it's been said before, a very poor memory recall of why that is, where they have to go to get it, because there's been a few incidents creeping from within our area where patients have been asked by other practitioners to take them down to Enniskillen Hospital to go and get a COVID test. Nothing else done, down into Castley to get a COVID test. So I don't want to see that being overly utilised, sort of like withdrawing ambulances or withdrawing PCS or doctors' motors to take a patient to get a COVID test. I think it's a total waste, and why they can't go through an ordinary lateral flow test, you know what I mean, and if they have the symptoms. I wanted to assure you that there was no other symptoms, and I know the staff down there has been a couple this week, and they're getting quite annoyed of what on earth is going on, because they have to start the whole paperwork. You know the way the whole paperwork has to start, doesn't matter what you go in with, the whole paperwork and everything else to come behind. So that's just something, Geraldine, I'm not sure if you're aware of it.
So I'm not really Councillor Fitzgerald, but I will follow it up. But what I would say to you is we have very strict guidance for pre-operative testing for patients coming into a green pathway at our hospitals. They must attend a Pillar 1 testing centre, and they must have a PCR test. So we are compliant with the current guidance, and I will go back to the testing managers to see what the issues are, why a patient would be moved from one site to another. I would assume at this stage it could be capacity, maybe there's too many or whatever, but I will check it out for you, Councillor Fitzgerald. I'm happy to come back if you wish, but there is very strict guidance. There's also isolation. Patient must isolate, they must have a test on a particular day, and they have to be retested then on admission and retested post-op. So there's very clear guidance which we must follow to allow that patient to attend for the green pathway. So I will pick up your issues with the testing people.
You can continue on now, Geraldine.
Okay, so the third point was about support services for people who have gambling addiction, and this is one that sort of I'm not really au fait with. My probably advice would be that we would you might want to ask the PHA, the Public Health Agency, about their prevention and treatment for gambling addictions. But however, I'm also going to, and I made a note before the meeting when I seen the agenda, ask for again our Director of Adult Mental Health Services, Karen O'Brien, for a trust position regarding addiction services and where we are at with gambling and what we have put in place as a trust to support people of the community or even anyone who has gambling addictions. And Chris, we'll pick that up with Karen and get it back to council members if that's okay. And apologies, I don't know the answer today.
Thank you. You may continue on. I see nobody is.
A similar for Carrickmore Health Centre. So I had asked the Director of Planning around the capital investment for Carrickmore Health Centre. She will do a brief for us, and Chris, you can share it with councillor members. It just hadn't come in before I started the meeting when I asked her this morning, so I'd be very grateful if Chris would pick that up with Teresa Malloy, and she will get that to you as soon as possible as an update. Number 5 is a rollout of the multidisciplinary teams within primary care, health centres, GP practices. So I suppose, again, this is a Department of Health decision about how it's rolled out, and it's be based on the number of MDTs which have been in through transformation projects and were tested in terms of patient pathways, etc., with transformation funding. The department, I understand, are planning a strategic roadmap to roll this out, and we know that the Southwest Federation is a very high priority within the rollout programme. I think they may be second, but I'm not entirely sure because they haven't published that yet. but that's where we are right now at this minute in time. So it might be worth a question to the Department of Health for further clarification on the rollout programme.
Thank you, Geraldine. I think Councillor McElduff wanted to come in on the previous point.
Yep, thanks. Paul. Thanks a million, Paul. Again, just to be very brief in my response to Geraldine on both Carrickmore Health Centre and then the multidisciplinary teams. There are two big issues of the moment. Just in relation to Carrickmore Health Centre, for years and years, it and Lisnaskea have been identified as perhaps two of the greater priorities in terms of capital build and having unsuitable premises for the size of the practice, etc. And I know that Lisnaskea is making considerable headway. I believe that to be the case. And I would like to see the same, obviously, for Carrickmore, because I think the catchment area of the health centre is in excess of 10,000. You know, I think the population catchment is beyond 10,000, and it's a very small building. So that's why I'm just keeping it on the agenda, you might say, and thanks to Geraldine for her initial response. And then secondly, on multidisciplinary teams, other councillors present may have been able to attend a meeting with the Health Department and the Health and Social Care Board in the past week. I wasn't able to attend that meeting, but just to keep that on the agenda as well, that in primary care, that's being cited as the solution, you know, for increasing times when people are seen, etc. Not putting the whole pressure on the individual GP or GPs, but making use of a wider team. So that's basically it. Just keen that they are both kept on the agenda of these meetings. Thank you, Chair.
Thank you.
Yes, and happy to bring anything back that we can in terms of the rollout, Councillor McElduff, when we receive it or if we do receive it. But absolutely agree. I think it's really important. And as I said, the Carrickmore Health Centre piece, as soon as Teresa gets it to me, Chris will forward it on to you, the update around that.
Thank you.
She did say she would do that for us today, so see how it goes.
Brilliant.
Okay, then the neonatal provision at Southwest Acute Hospital. So the director has provided a written update. Chris, I'm not sure if you've already shared this or if it will be shared. I suppose just to give you a summary of where we're at, and I'm happy to do this, but take back any questions then to the Director of Women and Children who's responsible for this service. So the neonatal unit at Southwest Acute, you'll all be aware, have 6 special cots commissioned there. They currently have 2 cots open due to staffing issues. Those that require, babies that require short-term care will remain on site following assessment and treatment, and those that require a high level of care will be transferred out to another unit, and that would have been normal practice anyway, prior to any staffing issues being raised within Southwest Acute Hospital. And I suppose just to give you some up-to-date data, from the 1st of October to the 31st of December, 6 babies were transferred out from Southwest Acute for a higher level of care elsewhere. So managers continue to actively recruit, although to date all efforts for staff who have the appropriate competency and skills have proved unsuccessful. It has now been escalated to the Regional Neonatal Network, the Public Health Agency and the Health and Social Care Board. And I suppose just to add to the situation, short-term sick leave due to COVID has also exacerbated to the situation as well for the director. So neonatal unit continues to be a concern for the trust, although just to reassure you all, everybody is doing everything they can to ensure that we have access for babies who require it at the Southwest Acute Hospital. And if there's any specific questions, I'm happy to take them back, as I said, to the director and get you maybe more detailed information if you require it.
Thank you, Geraldine. See, nobody has anything to raise.
Okay, so that was I think that was all the queries that you have, and I suppose if you wouldn't mind, could I just add a brief update on where we're at with our vaccinations, because I think it's important. just today that you're aware that numbers attending our centres have reduced greatly since Christmas. So CMT, our corporate management team, felt it was important that we ask for your support in trying to encourage people to attend for vaccinations where possible, or if you have the opportunity. So because the numbers have greatly reduced, we're scaling back the number of clinics. And from the end of the month, what we're looking at is smaller facilities with pop-up clinics, mobile clinics to go out and about to the areas where the uptake is particularly low. So just again, in terms of some detail, from the 1st of December to the 17th of January in the Lakeland Forum, over 24 days, there was 5,200 vaccinations, and Omagh Leisure Centre, for the same period, over a total of 16 days, we had 5,864 vaccinations. So in the southern sector, a total of just over 11,000 throughout that period. The details of all our clinics will be on our website and are on our website. On Wednesday the 19th, there is a pop-up clinic in Derrygonley. And next week, although it's not advertised yet, so it's just hot off the press, on the 25th of January, there'll be a pop-up clinic in Dromore from 4 to 8 p.m. and the 27th of January from Carrickmore from 4 to 8 p.m. So these are really focusing mobile clinics on areas of poor uptake. But I think it's just worrying that the numbers attending our centres have reduced dramatically for vaccination. And I think as elected representatives and representatives of the public, I think we would ask you to support and do whatever you could to get the message out there in terms of vaccination and the importance of it.
Thank you. Councillor Anne-Marie Fitzgerald.
Yes, to be very quick. Geraldine, can you give those two dates again, just for Dromore and Carrickmore? We appreciate it. Thank you.
So 25th of January, Dromore. 27th of January, Carrickmore. They'll go up on our website anyway. Anne-Marie or Councillor Fitzgerald, sorry.
No.
They're just not advertised yet, so they will go up there, but they just give them to me today to let you know that that's where they're targeting, areas of low uptake.
Appreciate it. Thank you, Judy.
Councillor Victor Warrington.
Thank you for that update, Geraldine. As somebody who is very pro-vaccination and put all dates and whatever up on social media day and daily, it's good to see the pop-up clinics starting to appear. Can I ask, obviously the two there, the last two that you mentioned was both in Tyrone based, and the one that's happening this week is in Derrygonley. Is there any more planned? I'm sure there is, but for certainly more centrally like Enniskillen, and certainly in around my own area like Erne East, which brings in a huge bit of ground. It would be nice to know if there's anything planned for there. And certainly, I think all the councillors here, we've discussed at the times, would be very pro vaccination, and we do get abused for it day and daily by the anti-vaxxers out there, and look, we just take it on the chin. They're letting themselves down. I think the sad thing about the anti-vaxxers and the pro-vaxxers, I think it's actually even, I was chatting to a constituent last week, it's actually even causing fallouts, unfortunately, within families. But that, anyway, that's a different story for another day. Thank you.
Okay, I don't have any further details with me, but we can get them, Chris, can't we? Yeah, Chris maybe has them there in front of him, Councillor Warrington.
Yes, thanks, Geraldine. And just to say, Councillor Warrington, you all have access to the link directly to the public representatives hub. So there is information on other mobile vaccine clinics which are confirmed up to the 1st of February. That has actually just gone up as well. So that's on the public representatives online hub. And what we'll do is, as each one is confirmed, but I do know that the plan is that these will be rolled out, particularly in areas where there is a low uptake, as Geraldine has said. So as any update happens, they will continue to be put up there so that you've got access to them in advance of even ourselves advertising them. So that's very available. That's there available for you.
Thank you for that, Chris. Chris, could I ask you to send me out? I probably have it, but can you send, or maybe even send it out to all the councillors, that link again to the elected representatives hub?
I will indeed, yes.
Thank you.
Councillor Diane Armstrong.
Thank you, Chair. Geraldine, thank you for that. I do, I can appreciate the difficulty of the drop in numbers in particularly in the leisure centres and the staffing issues. It's getting the balance. And for whatever reason, people are still hesitating. Is there any way, Geraldine, that, or perhaps it is already available, I'm not aware, about the percentage uptake in the district, within the Fermanagh and Omagh district on its own, as a guide to say we've reached this percentage first uptake or first vaccination second? And the second question is, when you mention pop-up clinics, do they include the booster vaccination?
Yeah.
Yeah.
Yes.
Thanks, Charlie.
So the percentage uptake, Chris, I don't know if we have that detail. We could ask Karen Hargan, our lead director, or Gareth Martin by council area. Can we get that? I wouldn't have it today, Councillor Armstrong, but maybe we can get it to you. Sure.
Okay.
That detail
Thanks.
is actually available, Geraldine, just to say from the PHA. However, we will provide it, and what we'll do is, as part of the next brief going out, we'll do a vaccine, because we do these quite regularly, particularly on that public reps hub, where we provide latest information with regard to the vaccine programme. So we'll do that, and we'll add those figures in. We'll get those from the PHA and actually add those in for you.
Thank you. Thanks very much, Chris, because using social media, it's something I think we can also promote and, encourage people and try to get the numbers up again and see where we are. So thank you very much for that.
That's all I have, and people looking to ask you questions, Geraldine, unless you have anything else to add, or?
No, I have nothing else to add, but happy to take any other issues. I'm not sure I'll be able to answer anything, or all of it, but I'm happy to take them back and come back with anything that we can do for you if there are questions.
Let's have Councillor Victor Warrington again.
Thank you. Sorry to be a pain. Geraldine, I take it, I know Bob's retired, hasn't he?
He has, yes.
And has he been replaced yet?
There's an interim director of primary care and older people and director of nursing, and that is Donna Keenan.
Donna
You might
Keenan.
know Donna from Omagh Hospital, from the Tyrone County, so she's now our interim director.
Okay. Okay, thanks for that. It's just
Chair,
a head.
remember, Victor, I remember Donna winning a major regional Nurse of the Year award, I think, isn't that right?
She did buy for after the Omagh bomb and all of that. Yes, she did, for her response to it. Yeah.
That's good. Just have a couple of ongoing issues with that department at the minute, so it's good to know who.
So Donna's there and available at Trust headquarters. Yeah.
It's good to know who to hound. Thank you.
Councillor Josephine Dehan.
Thank you, Chair, and I want to wish Donna all the best in her new role. She certainly is a very impressive professional. Chair, my apologies. I actually had to pop out of the meeting very briefly to take a phone call, but I'm not really a question, but I have raised this in our most recent meeting with the Trust, and I don't want to labour the point, but it's just really to appeal to the Trust to try to progress the provision of accommodation for the rollout of the multidisciplinary teams. I think it's important that primary care should be in a state of readiness once the bid for the MDT teams has been approved, and certainly we should anticipate accommodate. We have done some work on identifying accommodation needs for multidisciplinary team working, and I would just appeal to the Trust to try to progress, to do what they can do to provide additional accommodation so that we can be in a state of preparedness. We are assured that the Southwest area is high on the priority list for being awarded MDT teams, and my concern is that we should be in a position to avail of those opportunities as soon as possible. Thank you, Chair, for allowing me to make that comment.
Thank you.
I'm happy to take that back, Chair, to our corporate management team tomorrow morning.
That's it. I have nobody else looking to raise anything. Is that you,
Okay.
Chair?
Yes, that's me. Happy to leave if you are content.
Oh,
Everyone?
yes. Unless Trish has anything he wants to add?
Oh, that's fine. Thanks, Chair. Just to say again that on the basis of if there is any specific queries, etc., feel free to come through myself as the single point of contact for elected representatives in the Western Trust. And if there's anything that we can help with, you have my contact details there, and I'll get the link sent out, which has those details all on it as well on the Public Representatives Hub.
Thank you.
Thank
again,
you, Chair.
Thank you to you for taking your time to brief us on them points. Thank you very much.
Okay, bye-bye. Bye.
All right.
Okay, next on our agenda is number 7, is correspondence.
Just to confirm, Chair, we have no correspondence for this meeting.
Okay, thank you. Next is number 8, to agree dates for future health and social care services.
Yes, Chair, we have a range of dates now just to suggest to members, and these have all been confirmed with the Trust as being suitable. So the next meeting would be the 27th of April at 2:30 p.m, a slightly later start. Then the other dates, 19th of July, 18th of October, and the 24th of January next year, all at 2 p.m. starts, and they're all Thursday meetings, Chair.
Can you repeat that again, Alison? The 24th of July, or the 24th?
Sorry, the 27th of April,
Yeah.
the 19th of July,
Yes.
the 18th of October, and the 24th of January. And with the exception of the April date, they would all be 2 p.m. starts.
And April is 4 p.m.
No, 2:30 p.m. 2:30 p.m. on the 27th of April.
Okay, appreciate it. Thank you.
That's a Wednesday, Alison. That's a Wednesday.
Sorry, I said Thursday. Apologies. So that would be Wednesday, the 27th of April. Then it would be Tuesday, the 19th of July at 2 p.m.
Yep.
Tuesday, the 18th of October at 2 p.m. And I think also Tuesday, yes, the 24th of January at 2 p.m. And Chair, if members are content with those dates, we could get the electronic invitations issued so they'd be in your calendars.
Yep.
Yeah.
Thank you.
Councillor Errol Thompson.
Thank you, Chair. And it's just a query for our Chief Executive as to why we're changing around the different days. Is there a reason for it, Alison? Just a query.
Yes, Chair, it was to work better with trust availability, just in terms of the representation who'd be available. There are some standing meetings, and we thought it was better to maximise their attendance where we could.
Thanks for that, Alison. I take it they will continue to be via WebEx?
Well, certainly, Chair, for the foreseeable future, I would imagine that, and then obviously as the wider health situation improves, members could always review that if they wish.
Thank you, Alison. Thanks, Chair.
Thank you. Somebody else? Go on to item 9. Any urgent and relevant business?
No, Chair, we're not aware of anything being raised now unless any members have contacted you directly.
No, I have had no contact. No. I take it we have no confidential business?
No, Chair, no confidential business, so that would just conclude the meeting now.
Right. Can I say thank you for your attendance, councillors, and to the Chief Executive and to the Democratic staff for hosting this, and probably see some of you later on the meeting.
Okay, thank you.
Thank you, Chair. Well done.
Thank you very much, Chair.
Okay, bye-bye.
Thanks. Bye. See you later.